Good morning. Thank you, John, for the introduction, and thank you for all the initiative from NEI NIH. Thank you, Dr. Namrata, and also Dr. Takeshi. I think already John mentioned about all this. And yesterday, when I took Dr. Takeshi to our Shankar Natarajan, I asked him, "What's your goal?" He says, he spoke about the audacious goal program yesterday in the afternoon, and he said they were discussing about 15 years, and it's too long for him. And he says in the next 5 years he wants to find all the genes for the ophthalmic diseases, and that's his dream. So that's how I think he is dreaming, and I think you saw how the Asian Eye Genetics was born, and thanks to again to Takeshi and all this has been mentioned. So this we leave this to Dr. Kumar Manikvel to decide, because Dr. Takeshi is going to talk about Japan, and Kumar is in the process, and Dr. Namrata also will help. So I just wanted to highlight this. This was on the International New York Times when I just passed through Germany. I got the paper. Obama sets $250 million for tailored medicine, and research project aims to collect genetic data of 1 million Americans. And President Obama on Friday, that's last Friday, announced a major biomedical research initiative, including plans to collect genetic data on 1 million Americans so that American scientists could develop drugs and treatments tailored to individual patient-specific characteristics. Dr. Francis S. Collins, the director of the National Institute of Health, said the studies would help doctors decide which treatment would work best for which patients. And White House officials said the precision medicine initiative, also known as personalized or individualized medicine, would begin with a down payment of $215 million in the President's budget request for the fiscal year that starts on October 1st. Mr. Obama announced the details at a White House event on Friday with patients, advocates, researchers, and drug and biotechnology company executives. Researchers have been collecting and storing human tissue and other biological specimens in the 1990s in repositories known as biobanks. And you can see, I think Mr. Obama also plans to request $10 million for the Food and Drug Administration, which regulates the technology that's used to analyze DNA. Such analysis can identify millions of genetic variants with results that could help diagnose or treat some diseases, officials said. So the main thing is, I think they have mentioned that when we see both the presidents, I hope something will come out, and Dr. Gyan from the other side will help us in the collaboration, the Indo-US collaboration what we have. And we are all here. The eye has had a pivotal role in the evolution of human genomics. At least 90% of the genes in the human genome are expressed in one or more of the eyes, many tissues and cell types at some point during a person's life. And macular dystrophy is characterized by, I am not going into the scientific details, and the whole idea is to initiate interest with all the ophthalmologists, and that's why we requested for a session on the and I think all this I leave to Kumar and Shubho to talk about it, because I only wanted to go to the and give more time for the I also wanted to say that there are some work, these are all publications from Dr. Kumar, and again I am not going into the details. And I wanted to say the need for research is there are the discovery that ABCA4 is involved in transporting vitamin A derivatives out of outer segment. This led to the discovery that vitamin A inhibitors such as phenretinidine inhibit the accumulation of lipofuscin in animal models of Stargardt's disease. The identification of the role of VEGF in CNM led to the development of therapeutic antibodies to combat the major blinding complication of age-related macular degeneration. I think this was the research in the 90s, and in the 2000 onwards the beneficiaries are there. The growth factors and neuroprotective agents have also been used to reduce the rate of an apoptic response to inherited cellular abnormalities. In recent years, gene replacement therapy, therapeutic stem cells, and retinal prostheses have also moved to the threshold of clinical use for the treatment of genetic eye disease. And the widespread application of linkage analysis and mutation detection techniques has helped complex underlying pathology has now been revealed. Improved knowledge of the mechanism of the underlying molecular genetics has raised the potential for future development of rational therapeutic regimens, and also it has helped to refine diagnosis, disease classification and prognosis, and improve genetic counseling. And I wanted to show the movie from Moorfields.
For sufferers of hereditary blindness, there may be a light at the end of the tunnel. 2 experimental trials have shown that gene therapy could one day cure a rare form of blindness that affects about 2,000 Americans. The research teams tested the treatment on a total of 6 patients. Here you can see how they performed the eye surgery. Repaired genes were injected into the eye of this young visually impaired patient. The eye was infused with air, then reinfused with fluid near the end of the surgery. To measure the patient's performance before and after the treatment, he was guided through an obstacle course. Here you can see how he navigated through the maze prior to the surgery. He bumped into obstacles 6 times and was disoriented twice. It took him 77 seconds to finish the course. 6 months after the treatment, the patient showed a dramatic improvement. He was able to make his way through the maze in 14 seconds without bumping into anything or getting disoriented. He was one of 4 patients that showed an improvement. The treatment also proved to be safe, which has not been the case with previous gene therapy trials.
And that's the reference, thenewscientist.com, and thanks Kumar for giving me this video. And I don't know how many of you were there in the RO last day, and it was nice that the president of RO brought the patient who was the beneficiary of the gene therapy, and the patient's father also was on the stage. And I think the last day was an eye-opener, and also the first day of the how to work for a Nobel Prize. I think the whole idea is, I think we are all here to as Takeshi's dream and John's dream to realize, and we need clinicians and geneticists to work together. Thank you.